When sitting up out of a chair, it's important to avoid leaning forward too much when pushing yourself up, especially if you've been told by your healthcare provider to avoid this. Once standing, you can place your hands on your walker, but make sure not to put all your weight on your walker, as this can cause you to fall. When sitting down, it's important to make sure the back of your legs are pressed against the seat of the chair before sitting. Make sure to use your arms to help guide you down, and try to avoid bending forward too much if you've been told to avoid this after hip surgery. When you get out of bed, make sure you place your walker on the side of your surgical leg. When getting out of bed, if you've been given hip precautions, follow these carefully by avoiding bending too much at the hip and using your arms to help swing your surgical leg into sitting. Once standing, you can place your hands on your walker, but make sure not to pull on your walker, as this can cause you to fall. When getting into bed, try and make sure your surgical leg is on the outside. Make sure when you are reversing back into bed that the back of your legs touch the bed and that you can reach the bed with your arms before sitting down. If you have been given specific hip precautions, follow these very closely by avoiding leaning forward too much and guiding your surgical leg into bed using your arms. This way to walk is used when you are trying to take weight off your surgical leg. You step forward first with your surgical or injured leg and move your walker forward slightly while taking pressure off of your leg by using your walker for support. Follow with your other leg and step directly to your first foot. This way to walk is a progression when you can put more weight on your surgical or injured leg. This walk should look more like your normal walk, with one foot going in front of the other. When using a cane, bring your surgical or injured leg forward at the same time you move the cane forward to offload weight. When you turn, it's important to avoid turning too sharply. Instead, walk in a big circle until you have fully turned around.